Hi, I'm Stephanie. I'm going to talk to you today about some easy, quick, simple stretches that you can do at your desk to help prevent carpal tunnel or at least alleviate some pain associated with carpal tunnel disease. So many of you may not know, but carpal tunnel is caused by compression of the median nerve. The median nerve basically starts up here. It's connected to the brachial plexus, and the brachial plexus comes down, comes to about right here, and it branches off. You'll have the ulnar nerve and the radial nerve, and then you have your median nerve, which comes down your arm, and it comes all the way down to your hand. And symptoms that you might have is numbness, tingling, weakness, and pain in your thumb and in your first three fingers here. So the first thing I do when someone tells me that they have carpal tunnel disease is I first inspect their shoulder. A lot of times people who have desk jobs are very rounded forward in their shoulders, and the pecs become compressed, and that can actually compress your median nerve, which then can cause pain and be a part of the problem associated with carpal tunnel disease. So I just wanted to show you a few quick stretches to see if that could maybe help you at your desk daily and help prevent any further problems. So the first thing I want to talk about is just basically sitting at your desk and just randomly throughout the day, just kind of stretch your neck really slowly all the way around. You want to do it nice and slow and easy and kind of feel the stretch in here. These are your scalenes and your traps and part of your pec. And you can even tuck your hand under your cheek there or around your chair, and that can help with some added traction to what you're doing. And just slowly go all the way around. And I can hear my neck popping as I'm doing this. So you want to do that a few times. Get yourself loosened up. All right, the next one we want to show you is squeezing of the shoulder blades together. So that's basically just what I said, squeeze your shoulder blades together. You want to hold that for 5 to 10 seconds, and that really helps open up that chest wall, because that could, like I said, possibly be impinging on that median nerve in that area right in here. So do that a few times. Just stretch that out and do some shoulder rolls with it. All right. The next one I want to show you, I don't really know the name of it, so I just call it the prayer. So you basically clasp your hands together like this, and you're going to slowly rotate your hands down, and your fingers are going to go all the way back, almost to your belly button. And this is really difficult to do at first, but then after you do it a few times, it really does help loosen up the wrist and the forearm. So you're going to want to do that a few times as well. The next stretch I want to do is the continuation of stretching out this back area, your shoulder blades, to help loosen up the chest. And that is basically a rhomboid stretch. So you're going to reach your arm across your body and use your other arm kind of as traction and pull it in towards you. And you should feel a stretch like in here all the way up through your arm. And it just feels really good. Just hold that there for 15, 20 seconds. And then you're going to want to switch to the other side and do the same thing. And I would do these at least 2 to 3 times a set. And again, do them randomly throughout the day as many times as you can. All right, do a couple shoulder rolls, shake that out. And then the last one I want to show you is stretching of this here. So you're going to want to extend your arm out like so. Use your opposite hand and pull your fingers back. This is a really deep stretch, and you can really feel it all in here. And that really does help loosen up any muscles or tight tendons around that median nerve that could be in your wrist, causing the problem. You can even go further and individually stretch each finger. If you wanted an even deeper stretch with this, you can place your hand against a wall and push into the wall, and that'll give you a really deep stretch. All right, that's what I have for you today. Thank you for joining me.